guys, how are you doing? I hope you are doing well, and welcome to today's session of learning. So today I want us to learn about gestational diabetes. I want us to understand what is this gestational diabetes and how it occurs, and what you should do as a lady when you notice or when the doctor tells you that you have gestational diabetes. So karibu sana. If you are a new member, feel most welcome. If you have not subscribed, please consider subscribing, and let's grow this channel. Okay, so what is gestational diabetes? So I know you have heard about the term diabetes, and so in today's topic we're going to learn about diabetes during pregnancy. Okay, so gestational diabetes is a diabetes that is first diagnosed during pregnancy. Okay, so there is diabetes mellitus. We have type 1 diabetes, type 2 diabetes mellitus, which usually occurs to people when they are not pregnant. And there's this type of diabetes that is called gestational diabetes. This is the one that occurs when a woman is pregnant. So what happens is when you were not pregnant, you were okay, you didn't have any diabetes, but during pregnancy, when you are in your third trimester, you are for the first time diagnosed with high blood glucose levels, which is called gestational diabetes. Okay, so it is a diabetes that is discovered first during pregnancy. So previously you didn't have you didn't have diabetes, but during pregnancy in your third trimester you are diagnosed with diabetes. This is the type of diabetes that is called gestational diabetes. Okay, so it causes high blood sugars, okay, that affects both you, a pregnancy, and also your baby. Okay, so high blood sugars during pregnancy will affect both you as a mother and also the baby you are carrying. So this is why it is very important during pregnancy for you to go for all your antenatal clinics, so that just in case when a problem like diabetes sets in during pregnancy, it's able to be discovered, and then you are advised accordingly, so that it doesn't affect the baby. Okay, because if not well managed, it will affect both you and also your unborn baby. So I want us to know what are the signs of diabetes, okay, during pregnancy. Most of the time you might not be able to notice when you have diabetes. Most women, it is discovered that they have diabetes when they go for antenatal clinics, when they are just checking random blood sugars. That is when they notice that a woman has high blood sugar levels. But some of the symptoms of high blood glucose during pregnancy is increased thirsty. You have an increased urge to take a lot of water. Okay, some people may end up taking like 5 liters of water in a day, and also we have increased urination. So as you take a lot of water, you also have increased urination. These are the two most common symptoms of high blood glucose levels. We have increased thirsty, increased intake of water, and also increased urination. These are the two major symptoms, but most of the time you might not experience these symptoms. Utakuwa tu umeenda clinic as usual, and then during a random checkup of your blood glucose levels, they will note that it is high, and then that is when you will be diagnosed with high blood glucose levels during pregnancy. Okay, so what are the risk factors of gestational diabetes? Number one, we have overweight. So when you conceive, before you conceive, if you are overweight or you are obese before you conceive or during your conception, it increases your risk of having gestational diabetes. So before you conceive, make sure that you shed some weight, because high weight, when you are obese, you have an increased risk of getting gestational diabetes. Number two, we have previous gestational diabetes. If you have ever been diagnosed with gestational diabetes before, so just know that in your subsequent pregnancies, you might also have this gestational diabetes again. We have family history of gestational diabetes. If maybe your sister or your mom or someone in the family has ever had gestational diabetes, then you are also at a risk of getting gestational diabetes. We also have maternal age of 35 years and above. If you conceive when you are 35 years and above, you are at a risk of getting gestational diabetes. We also have people who have had polycystic ovarian syndrome. They also have an increased risk of getting gestational diabetes. Those are the risk factors. Okay, so it doesn't mean that if you lie on the list of people who are at a high risk, you will get it, but there are high chances that you might have gestational diabetes if you lie on the list of the people that I have mentioned. So what are the complications of high blood glucose levels during pregnancy? So when you are diagnosed with gestational diabetes, it is so concerning. I know for the first time when the doctor tells you that you have diabetes during pregnancy, it is you might feel might have a lot of concern, but as much as you might be having this diabetes, there is management. Okay, so your doctor will know how to go about it, how he will treat you, how he will ensure that your blood glucose levels are low, so that it does not affect both you and your baby. Okay, so it is concerning, but the good news is that your doctor will walk with you throughout the pregnancy journey until you deliver your baby. So what you will do is you have to take the doctor's instructions, okay, so that you deliver well, and also you don't develop the complications of gestational diabetes. So first of all, I want us to know what are the complications. If your doctor tells you have gestational diabetes and then it's not well controlled, what will happen? Number one, you will give birth to a big baby. Okay, So what happens when the blood glucose levels is high in the system of a mother? It goes directly through the placenta. It crosses and goes to the baby's system. So when the baby's circulation also has high glucose, then your baby, you will deliver a big baby. Okay, so, and because you will have a big baby, you might end up going for a CS to deliver, because this baby who will be 4.5 kgs might not be able to be you might not be able to give birth through the normal delivery, so you might end up going for a cesarean section to give birth. So number one, if not well controlled, you will have a big baby. Number two, you will be needed to go for a CS to deliver. Number three, we have a preterm baby. Okay, so because of having a big baby, the doctor might recommend an early delivery. Okay, because this baby, remember, if the blood glucose is high, this baby will continue growing big. So your doctor might recommend you to give birth early. Okay, and so this is now what we call a preterm baby. Okay, and giving birth to preterm babies comes with its complications like respiratory distress. Okay, also high blood glucose levels might lead to early labor. Even before the doctor recommends, you might go into early labor because of high blood glucose levels. We also have low blood sugars. You see, because the baby's blood glucose levels are high, the system of the baby will just sense that the blood glucose levels are high, and it will start producing a lot of insulin, and this insulin will enhance high glucose intake to the cells, and this high glucose intake to the cells will lead to low blood sugar in the blood circulation, which leads to hypoglycemia or low blood glucose levels. You also have stillbirths. This is when you give birth to a baby who is already dead. We also have type 2 diabetes later in life. So imagine if your doctor tells you that you have high blood glucose levels, you're given those instructions, and then you don't follow them. Your baby is going to have all these complications. You might give birth to a stillbirth because of high blood glucose levels. You will predispose your baby to, it predisposes your baby to type 2 diabetes later in life. We also have low blood sugar levels. We have respiratory distress. We have a large baby. We have a preterm baby. This is when the doctor might recommend early delivery because of the size of the baby, or you still might go into early labor because of high blood glucose level. Those are the complications to the baby. Also to the mom, we have complications like CS delivery. Okay, because you had planned for a normal delivery, but just because your baby's size is too big, you will go for a CS delivery. Also moms, some of the moms, most of the time, this gestational diabetes ends when you deliver. Okay, But some women proceed to having type 2 diabetes even after giving birth. Their blood glucose level still remains high, so you have type 2 diabetes. We also have high blood pressure during pregnancy. Imagine when your blood glucose levels is high, if not well controlled, then you will have a complication of also having high blood pressure, and this is a risk to both you and also your baby. So what can we do to prevent diabetes during pregnancy? Number one, lose weight before getting pregnant. If you're a woman who is obese, if you're a woman who is overweight, obesity predisposes you to having gestational diabetes. Make sure before you conceive, you shed off some weight. Okay? Some of the risk factors, you can't prevent them. So if you can't prevent them, there's nothing you can do about it, like a family history or having a polycystic ovarian syndrome. You can't do anything about it, but if there's something you can do about your weight, please just shed your weight before you conceive. It helps you to protect yourself from getting gestational diabetes. So now, what is treatment? If you have been diagnosed with gestational diabetes, what do you do? Number one, frequent monitoring of your blood glucose levels. Ensure you have a healthy blood glucose level so that you don't predispose yourself to these complications. Okay, so make sure you check your glucose levels 3 days a day. Just check them, or twice a day, in the morning and also in the evening. Number two, make sure you take your medications. Zile dawa daktari atakupatia, ensure you take them as prescribed. Don't overdose and also don't underdose. And before you take your diabetes medications, make sure you take your medications as prescribed by your doctor. Do not underdose, do not overdose. And also, before you take your diabetes medications, please make sure you eat. Just eat before you take, or immediately you take. Make sure you eat something, because if you don't eat and then you take your dawa, your blood glucose level will go down. And if it goes down, then that one it is even very dangerous. Very dangerous if you take your high blood glucose medications and then you don't eat. Imagine these medications are meant to lower your blood glucose levels, and then you don't eat. What will happen? So ensure you eat, and then eat healthy foods as advised by your nutritionist. Okay, so remember, when you have diabetes, you just don't eat any meals. There's a specific list of foods that you are supposed to eat. Ensure you eat as advised by your nutritionist, because if you don't eat healthy, even if you take your medications, they won't work. Okay, these things will be just like you're doing nothing. You're eating sugar and you're on hyperglycemics. So how will it work? It won't. So make sure you take an advice from your nutritionist and eat recommended meals. We also have be active. Be active. As much as you are pregnant, try and be active. Okay, even just taking a walk. Don't just be too lazy. Try and be active. Do some physical activities in the house, but do not do heavy duties. But then do not be lazy, just stay active. Okay, make sure you go for your antenatal checkups. Sawa. That is how your doctor will monitor and see if your medications are working well. They will also do some investigations like ultrasounds to check the size of the baby, okay, to check the heart rate of the baby, to check for blood circulation, generally to check the well-being of your baby. Management to the baby. Immediately your baby is born, if you give birth to a preterm, then preterm babies have some of their complications like respiratory distress. If your baby has a distress, your doctor will put them on oxygen. They are required to check blood glucose levels for this baby for quite some time until they ascertain that this baby's blood glucose levels is okay, because there is a risk of going into hypoglycemia. So make sure you feed your baby well, and if the baby is not feeding well, inform your doctor, and also your doctor will be monitoring the blood glucose levels of this baby mpaka akwe stable. Okay, yes, so that is it for gestational diabetes. If you can prevent it, try and shed off some weight. If you're obese, shed some weight before you conceive. That is one way of reducing the risk of getting gestational diabetes. But some of the factors, you can't control them. So just in case you have gestational diabetes, just seek the medical attention. Your doctor will help you and will walk with you through your pregnancy journey until you give birth. Sawa. Yeah, that is it for gestational diabetes. If you have any questions, ask me down there in the comment section. I will try in my level best to answer your questions. Thank you so much, and see you in the next session of learning.